The first study into Omicron is out. Scientists in South Africa say vaccines provide significantly less protection against the new coronavirus strain. But need we fear the worst? I'm Andrea Sankey, and today's newsmaker is the Omicron variant. Well, it's the most mutated version of the coronavirus so far, and in the first lab results released on the Omicron variant, there's reason to be both hopeful and fearful. Scientists from the Africa Health Research Institute tested the plasma of 12 people. All had received 2 doses of the Pfizer-BioNTech vaccine, and 6 had also recovered from COVID-19. The study concluded that the vaccine provides less protection against the new variant.
Laboratory research from South Africa strongly suggests that the SARS-CoV-2 Omicron variant escapes antibody immunity induced by the Pfizer-BioNTech vaccine, but that considerable immunity is retained in people who are both vaccinated and previously infected.
So if you've already had COVID-19, you're better protected against Omicron, as long as you're also fully vaccinated. But more detailed analysis showed there was a 41-fold drop in the ability of vaccine-induced antibodies to neutralize the variant. But it is a small sample, and the study has not yet been peer-reviewed. Ur Shaheen, who created the Pfizer-BioNTech vaccine, says he's more optimistic about the shot's ability to cope with the mutation. And the WHO is hopeful vaccines will still provide enough protection against the most severe symptoms.
And I would expect, quite frankly, that the vaccines we currently have will show efficacy against severe disease and hospitalization. But we have to measure that, and we have to confirm that that's the case, and we also have to confirm if there's any loss in that protection. But I would expect to see some protection there. And that's why it's so important that that's the best weapon we have right now, is to get vaccinated.
So far, vaccines have been extremely effective in the overall fight against the pandemic. Wednesday marks exactly 1 year since British grandmother Margaret Keenan became the first person to ever receive a COVID-19 vaccination. And while we've seen cases of the disease rise and fall throughout the year, the numbers suggest the shots are at the very least saving thousands of lives. Here's a simple year-on-year comparison. On December the 8th, 2020, more than 613,000 people tested positive for COVID-19, and more than 12,000 died from the virus. But last week, on December 2nd, there were about 140,000 more recorded daily infections than a year before, but 33% fewer deaths at just over 8,000. Some scientists fear Omicron could overtake Delta and soon become the dominant strain. South Africa is seeing a rapid rise in Omicron cases, and it's already in at least 57 countries. So, will this latest strain set off another wave, or is it weak enough that we're well prepared to deal with it? To discuss that and more, I'm joined now from Birmingham, UK, by Dr. Lawrence Young, a professor of molecular oncology at Warwick Medical School. In London, we have Oksana Pyzik, a lecturer at University College London School of Pharmacy. And joining us later in the program, Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School. How much credence, first of all, should we give this latest report? We have to remember it was, just a small group of people that were in the study, about a dozen or so, and it's yet to be peer-reviewed. Still, Lawrence Young, do you take it at face value?
Yes, I think, this is what we suspected. The Omicron variant significantly, but not completely, escapes immunity induced by vaccination. This is a small study. It's in people who've been infected and then were jabbed. But it does confirm what we suspected, which is that this current vaccines are likely to be less effective against Omicron, but not totally ineffective. That's the important message.
Okay, so the variant may partially evade vaccines, particularly the Pfizer-BioNTech vaccine that we're hearing about. But with a booster, we are much safer, and having been previously infected is an even bigger blessing. Is that correct?
It looks that way. And I think if you start to model this, it might well be that you get protection from severe disease, but that mild disease may still be problematic. It may perhaps halve the risk of getting a mild infection. And indeed, that's what we're seeing in South Africa. A lot of the current reports are about mild infection in vaccinated individuals, and in people who are being hospitalized, there is a less of a need to be ventilated. But I still have to say we need to keep a very close eye on the data.
Right. So, Oksana, I mean, just to be clear, that at this point, infections are spreading quickly, but we are seeing fewer hospitalizations and fewer deaths from all the data we've seen so far.
Yes. However, there's also a lag. We know that really in the next 2 weeks, we see huge acceleration of cases in the UK. It looks like Omicron is the doubling rate is now every 2 to 3 days. We should try to implement Plan B as soon as possible to slow that down to 7 days if we can. But we'll see that again. There is this lag time. So although right now we're not at peak spread, which is why there isn't that same level of strain. But what's interesting from some of the data collected in South Africa is that there's also more young people, and particularly children, who are being affected as well, under the age of 4. And so we're going to have to also look at our pediatric capacity.
Do me a favor, though. Tell me more about Plan B, what it really entails, and why you think it's necessary.
So in the UK, Plan B is very similar to what European countries are already doing. One aspect of it would be ensuring, so in certain areas, Boris Johnson has re-implemented a face mask wearing, but Plan B would also encourage people to work from home where possible, in order to limit spread and break chains of transmission, more frequent testing as well, ensuring that the rapid tests that are free and available in every pharmacy across the UK, that people are using that before doing their errands or mixing with households. And again, because we're looking at a wave that could make Omicron the most prominent or dominant strain before Christmas, this will have to catch the asymptomatic and the symptomatic cases as well as we can, alongside more cautious measures. I would say Europe has taken it one step further with the introduction of the COVID pass, so that people have to actually show proof of vaccination before entering. That's not something that the UK has thought would be received well by the population, so they have avoided that. But we are going to now struggle in terms of increasing the level of vaccination across the country, not just for first doses, because they're going to be the most vulnerable in this next wave, but also making sure that we get boosters out as quickly as possible to those that need them, because that shows how the highest level of protection is with that booster shot against Omicron.
Okay. Lawrence, let me ask you if you actually think at this point, with the UK being one of the most affected countries in the world by COVID-19, is Plan B enough?
It's difficult to know. I mean, with the high rate of transmission, and we're thinking that this is going to be doubling every 2 to 3 days, so we're going to see this Omicron overtaking Delta probably by Christmas. A lot of it is so dependent not only on the effectiveness of vaccination, but on the degree to which Omicron is going to induce severe disease. You know, we're in the winter period with more respiratory infections. As much of this is about kind of, protecting individuals, it's also about protecting the NHS, our healthcare system in the UK. So I think what's not enough is what's happening at the moment. I do think we need extra restrictions. We need to be getting people wearing face masks in more settings, and to bring in working from home where possible. Other nations are doing this within the UK. Scotland have started to do this, and I think it's something that we just. I think we're going to hear more about that later today, actually.
Okay. We were exploring how this new variant may actually be able to evade or partially evade vaccines, but we still have antivirals on the table. We've talked a lot about them. really, how close are they to becoming a reality? And how much, Oksana, do you think they could be the game changer at this point if Omicron's symptoms in particular stay at the kind of mild level we see them at right now?
Well, look, there's a couple of things that are critical when it comes to the antivirals. First, it's that they need to be administered very early in order to stop the course of symptom development. So, and to prevent hospitalization. So, that's very key, and that will be to some degree challenging in terms of people coming forward and accessing these medications. Second is also supply, given how quickly Omicron is currently spreading across the UK, and as has been said several times, will do so before Christmas. We simply won't have that type of supply across the UK for the number of people who are vulnerable and can be affected. And then third as well is that the expected results in terms of reducing hospitalization isn't quite as good as originally hoped. There is still that extra layer of protection, and we need all the tools that we can to fight this virus, including so alongside vaccination, antivirals, as well as now it's looking like some more severe interventions that are non-pharmaceutical. So I think at this stage, it's going to be very helpful, but not to the degree that we would need in terms of supply to make a big difference before Christmas.
Right. Lawrence, important question for you. If we are now at higher risk of infection because of Omicron, even with milder symptoms, are we also at higher risk of long COVID?
That's always a concern, and in fact, it's something we're not hearing enough about. I don't think that even with mild infections, this can lead to long COVID. We don't know this yet for Omicron, but it does seem to be a relatively neglected area. We're not hearing enough about it, particularly with the infections being more prevalent in youngsters. This is a real concern. We know that this virus can spread to other parts of your body. It can infect, for instance, kidneys and heart as well as your lungs. And this is a real concern. And I think it's where most of us have a particular worry that whilst clearly we need to protect people from severe acute disease, and the hope is current vaccines will do that for Omicron, even with mild infections, you can have long-term effects. And this is building up a massive problem for us in the future, both as individuals and as healthcare systems. And it's something we need to be looking at in terms of identifying exactly what's going on. The trouble with long COVID is it's a very complex mix of different types of effects on our bodies. And we're only just beginning to grapple with it, to be honest with you.
Yeah, it's complex, I understand, but would you say it actually is a neglected area of study?
Yeah, I think it is. I think it's just difficult to study because it is so complicated. It has many features similar to chronic fatigue syndrome or post-viral syndromes. And they have always been very difficult to pin down. There's a significant physiological effect and a significant psychological effect. And I think, there are studies going on all over the world demonstrating a possible contribution of the body's immune system reacting against itself, autoimmunity being a feature of long COVID. But as I say, we're a long way from having therapies. And it is always a concern that as this virus continues to spread, even if we can control the acute infection, we are storing up issues for long-term effects that need to be very carefully managed.
Right. Oksana, I mean, how much does it worry you that, especially since we've been talking about the potential upside of Omicron being that the symptoms have stayed relatively mild? I mean, South Africa hasn't moved past level 1 restrictions because it's seeing the mildest symptoms, actually, and not that many hospitalizations and very few deaths. So the fact that this could actually lead to something some say is even worse, being the long COVID, and knowing that it hasn't really been factored into the equation at this point, does it worry you?
Well, yes, we also have to remember that South Africa has quite a young population. So the results that they're seeing may be different to the UK and Europe and elsewhere in the world. But absolutely, I mean, I think to some extent, people who have had long COVID have been accused of presenting with psychosomatic symptoms has not been taken seriously by the UK government at all, and almost barely mentioned in the press briefings. So, as Dr. Young has highlighted, it's going to take many years of research to fully understand not only the collection of effects that can happen to people, but the best way for people who do develop various complications or disabilities, what would be the appropriate level of support that they need. But it's just not, in the UK at least, not being factored into any of the COVID strategy that's ongoing, and the fact that 2 million people have reported that they are suffering from these symptoms, that astonishes me.
Okay, let's branch out again at this point and look at really the global fight against the pandemic. And Bharat Pankhania can join us now. There he is. Thanks so much for being with us and jumping in. We really appreciate it. We're back to really pushing for booster shots. And you and I had discussed this at length before. Now that we know that this vaccine can at least partially evade, the variant can at least partially evade the vaccine, and that being not just doubly vaccinated, but having the booster shot really is the best way to mitigate any further damage that can be done by Omicron. All of this focus on the booster shots and the full vaccination, while only 6% of the population in poor countries is vaccinated. Really, where are we then, Dr. Pankhania, in the global fight against bringing this greater pandemic under control?
We are in talk and talk a lot and do very little stage, same as where we were a year ago, which is very disappointing. So suddenly, out of the blue, with the arrival of Omicron, we've got a lot of commentators talking about helping Africa and other parts of the world where the vaccines have not been delivered. And really, I say to the European nations, the Americans, it is in your self-interest to get the train running now. It's not a question of we supplied you with the vaccines, now do it. You've got to set up the logistics, the infrastructure, the needles, the syringes, the recall system, the cold chain, and all of those things. All of that work could be ongoing now, pending the arrival of the vaccines. Better still, make the vaccines be available as soon as possible. And I say it over and over again to you and to anybody who's listening, which is, until we bring down the cases globally, it's pointless just bringing your cases down and you leave the other part of the world with high case numbers. And if you do that, you get what we got now, Omicron. Emergence of a variant in a place where there's runaway infections in immune suppressed people, you get variants.
Okay. And just to be clear, Dr. Pankhania, we had said before that this potentially, the upside to this could be that we might discover that this Omicron variant is just a weaker variant in general, and that overall the virus is weakening. Do you not see that as the potential silver lining here? Are you more fearful that this could only lead to greater problems?
No. We've got to be measured, and nobody wants to have hairs running. But at the moment, we are in the territory of we don't fully know, and therefore we should stick to we don't fully know. It may be that it is mild disease causing, all well and good. If, on the other hand, and these are my concerns, that if it is infecting a much younger age group, and causing serious disease in that younger age group, we have a big problem on our hands. So at the moment, we don't know. I hope and pray it is just innocuous. We don't know, though.
Right. Lawrence Young, Dame Sarah Gilbert, one of the people credited for developing the AstraZeneca vaccine, has said worse could actually be coming. That the next pandemic, she's actually looking forward, that even if the coronavirus somehow wraps up in the foreseeable future, we've got something worse to look forward to on the table. Is this just one more pessimistic scenario, or are most scientists kind of on the same page there?
Yeah, I think it's a gloomy but probably realistic assessment, in the sense that the West particularly felt that they were somehow protected from these infectious disease outbreaks. This was something that happened in sub-Saharan Africa and far away in Asia and was never going to affect us. Now we've learned the hard way, and it is a wake-up call. So I think there's a big issue here about how we prepare better for next time, and how we, as Bharat said, how we think about this globally. It's in all our interests to protect everybody. My view, for instance, is that a lot of these infections spread from animals, and that we've got to do more joined up research between animal infectious disease and human infectious disease. We need to be controlling what goes on in animals, and there's not enough of this going on around the world. There are very few places I know of where there is that integrated approach. And I think, and I hope, that this enormous and terrible situation that we've been in the last, coming up for 2 years, has taught us a lesson that we're all in this together, and that we need to prepare better next time, and that part of that has to be veterinary health as well as human public health.
Okay, interesting. I mean, Oksana, so while we are struggling with the coronavirus pandemic, are we possibly dropping the ball on preparing for potentially worse to come?
Well, certainly, alongside that, we know that even things like antimicrobial resistance could be extremely problematic for us, and that's a separate issue in terms of like the medicate that various bacteria could mutate to such an extent that our drugs are no longer effective. So there are unfortunately, issues that we all need to be paying attention to. And I really agree with Dr. Young on the One Health approach to ensure that our deforestation practices that push animals into new territories, and making sure that we're thinking about the effects of mega cities with over 11 million people living in sometimes very tight quarters. All of this is, again, what we've heard from the WHO, really trying to get attention of world leaders to create some kind of higher standard towards not just research, but policies and legislation around it. And I would say also that when we think about the upcoming treaty that the WHO is now negotiating with all member states, they need a consensus on not just for that is a pandemic treaty for the next crisis, because if we look over history, we see that there is a cycle of pandemics that occur, and we are contributing to that problem through the various ways that have already been discussed. But we need to pressure countries to actually commit to it, and legally binding instrument might be the way forward to ensure that those policies are in place. But there is some resistance from China and Russia around it. So we will see that, right now the WHO is not just thinking about what's happening with COVID, but also making sure that we have the correct political instruments in place to help leaders prepare for the next. I mean, the science is clear. We have, companies working on even variant-specific vaccines, but where we have failed is around political leadership and supporting people with behavior change. Even now, I think people just don't really want to take the threat seriously.
Very interesting. Yeah, global policy coordination. We all know that is a major challenge, and the pandemic has really exposed how much of a challenge that is. But Bharat Pankhania, Oksana was talking about the issues that she was fearing actually having to be bacteria related, and said that's a separate issue actually from the coronavirus pandemic. But let me ask you if you think it really is, because part of this pandemic has been mass sanitization. Many people have reverted to using loads of antibacterial soaps, wipes, constant cleansing, whereby some argue we're failing to build up the normal antibodies we would with normal exposure to bacteria, because the pandemic has made us so ultra hygienic. Is that another concern we should be taking more seriously? I know the alternative right now is keep us clean, keep us sanitized so that we avoid the coronavirus, which is the worst case scenario at present. But there are also other issues that develop from that hyper sanitization. Are there not?
No, I wouldn't worry about it, but I'll tell you what we should be addressing urgently is feeding antibiotics to animals to raise meat on the cheap. So when you are feeding your chickens, your pigs, your cows, all these animals with antibiotics, those antibiotics are entering the food chain, and they're entering the waterworks, they're entering all over the environment. With those antibiotics arises the emergence of many, many things. One is antimicrobial resistance. 2 is contamination of the environment. 3, the change of the ecosystem in rivers and the primary places where our food sources come from. So that is the problem, not the problem of we are excessively sanitizing.
Okay, Lawrence Young, you agree there?
Yeah, I do. I think there are lots of issues here. One of them, of course, that we need to consider is climate change and the impact of climate change on infectious disease. We're already seeing this in relation to malaria and mosquitoes creeping into southern Europe, and this is going to be an issue for the world. So again, a massive concern around how the environment in which we live is changed by what we do. So I support what Bharat's saying, and I think we just need to go that step further, being aware of the impact of climate change on disease.
Fascinating. Okay. Unfortunately, I have to wrap it there because that's all the time we have for this edition of the Newsmakers. I'd like to thank all 3 of my panelists so much for being with us, and to our viewers for tuning in as well. Remember, you can follow us on Twitter at @the_Newsmakers, and be sure to subscribe to our YouTube channel. I'm Andrea Sankey. We'll see you next time.